to start off, there's the pivot joint, the hinge joint, and the saddle joint, and condyle joints, and ball and socket joints. There are 5 different types of synovial joints, and you have the hinge joint, which is going to have a range of motion of rotation. You have saddle joint, which is going to have the range of motion of circumduction. Yeah, there are 5 different types of synovial joints. There's the hinge joint, which is going to have a range of motion of flexion and extension. You're going to have the pivot joint, which is going to have rotation. You're going to have the saddle joint and condyle joints, which are both similar, but those 2 are going to be having a range of motion of circumduction, and then after you're going to have ball and socket, which is going to be pretty much extension, flexion, rotation, and circumduction. It's everything. And so those are the different types of synovial joints, and now we're going to be talking about specific joints. Okay, so first you have the spine. And the spine, the range of motion is hyperextension, extension, flexion, lateral flexion, lateral flexion. The hip has a range of motion of rotation, flexion, hyperextension, extension. Next, you have the shoulder joint. So the shoulder joint is going to have rotation, circumduction, abduction, adduction, extension, and flexion. And then you have the hand, which is going to be the palm joints and the joints of the palm and the fingers. The palm joints are going to have hyperextension, extension, flexion. The fingers are going to have circumduction, extension, flexion, and then you have the knee joint, and the knee joint is going to have hyperextension, extension, flexion. And then you're going to have the elbow joint, which is going to have extension, flexion only. Also, the elbow joint is going to have extension and flexion only, and supination and pronation. And then you have the feet, which is going to have the ankle and the toes. The ankle is going to have inversion and eversion. It's going to have flexion and extension. The toes are going to have extension, flexion, and abduction and adduction. And you're going to have for the ankle palmar flexion. You're going to have and dorsiflexion. And then you have the palm, which is going to have the fingers and the palm joints. And the palm is going to have flexion, flexion, extension, hyperextension, and the fingers are going to have flexion, extension, and circumduction. Those 7 are the specific joints. And what key points that I wanted to point out was that hyperextension occurs only with the palm joints, the knee joint, and the hip joint. Those are the only 3 that have hyperextension. And for abduction, you have abduction and adduction. You're going to have the hip joint have abduction and adduction. You're going to have the shoulder joint have abduction and adduction. And you're going to have for the palm, it's only going to be abduction, only abduction for the palm. And for the foot, you're going to also have adduction. You're going to have both adduction and abduction. So the spine doesn't have abduction or adduction. That's a key note. That's a key thing to remember. And also the elbow does not have abduction or adduction. So those are the key points for extension and abduction. And also, there are tests of these joints, and the joints that are tested are for the palm joint, or the hand joint, which is called Fallon's test. This is Fallon's test. And for people who have carpal tunnel syndrome, 80% of them who are positive of having carpal tunnel syndrome is going to feel pain or tingling. And once you have a Fallon's maneuver, which is positive, you're going to move on to Tinel sign. And then there's a test for the knee, and it's called the Bulge Test and the Ballottement test. The Bulge Test is going to be for if you have fluid buildup in the bursa. And so the bursa, you can feel it through the side of the knee. And if there is fluid, if there is an enlargement, that means the bursa is filled up. So the Ballottement test is a test to see if there's fluid in the knee, and you can push the kneecap, and if the kneecap floats, then it's a positive test for Ballottements, and that means that you have fluid in your joint. So if you do a hip flexion and there's pain, it's a sign of maybe possibly a spinal cord disorder, an inguinal hernia, or arthritis. And that concludes the types of synovial joints, the range of motion of those synovial joints, and the different types of testings that can be done to test the condition of the synovial joints. Thank you.